Yeah. So hi, good evening, everyone.
Good evening, Dr. Malik. We're so happy to have you on India's first and the biggest metabolic health conference. We're really wonderful to have you here, and it's been a fantastic day so far. And we're so looking forward to what you have to share.
Yes,
Before we
thank
get
you,
there,
thank you so much, Shashikant sir and Anup sir, for giving me the opportunity to share my orthopedic knowledge on India's first low-carb conference.
let me just give a quick introduction about you to our audience. Dr. Mihir Malik is a consultant trauma and a joint replacement surgeon based in Navi Mumbai. He has completed his MBBS and MS Orthopedics from Sion Hospital, Mumbai, and he's the Maharashtra state topper, gold medalist specifically. He's also undergone specialty training in knee and shoulder surgery from New York, USA. Dr. Malik, very quickly, would like to understand how you got introduced to LCHF. What was your turning point to the low carb nutrition and the entire side of moving on to low carb therapy?
Yeah. So 3 years back, the COVID pandemic hit us. And at that time, I was working as a resident doctor in Sion Hospital, Mumbai, which was a tertiary care center where all COVID patients and seriously ill patients from COVID were transferred. When I was there in the ward, what one thing I noticed that majority of the critically ill patients who were brought there had uncontrolled sugar. And most of them, around 70-80%, were not getting controlled and their immunity was very low. So that rung a bell in my mind that if there has to be some relation of high glucose, which causing a low immunity, making these patients more predisposed to COVID. So that day, I went to my room. The first thing I thought about it was if I have to be amongst them and serve the patients, I myself have to be fit. So I was weighing 96 kilos back then. My BMI was above 30. So the first thing I did that day was I uninstalled all food apps from my phone. Then I was staying on the fifth floor of my hostel back then, so I started climbing up the stairs. And I did a few things. The first thing was that I did a calorie restricted diet. I started with an intermittent fasting of starting with 14 hours and good sleep of around 7 to 8 hours. So following these few steps over the next 6 to 7 months, I lost around 10 to 12 kgs. And then there came a plateau phase that my weight was fine and everything was fine. And then I looked up on YouTube that what YouTube and Google that what more can I do to change myself. Then I saw a few videos of Dr. Jason Fung, who has written the book called The Obesity Code. And after that, I got into low carb diet. I started moving. I increased my fasting to 16 to 17 hours, and now I do minimum of 16 hours fast every day. So now my weight is around 71 kilos. My BMI is 23.2. And I feel fresh. I feel good. My lethargy is gone. My knee and back pain is gone. So the same thing, being an orthopedic surgeon, when such patients come to me, my first thing is that I have to tell them about this, that if you do follow a certain protocol, half of the problems are solved. So that's how my journey started in this.
That's fabulous. I mean, it's not a joke reducing 20 kilos,
Yeah.
in the conventional dietary approach, typically you lose that, but then a lot of people have come to me, and I'm also hearing from others that they gain back. In fact, they gain more than what they actually lost, right?
Correct, correct.
Uh,
Actually, what happened in COVID was two two groups of people formed. One who realized the importance of health and they got back to the weight and they are still sustaining it. And the other group of people, they just went haywire with everything.
I think
And now they think that the last 3 years they should have taken some steps to control their health.
very true, very true. So, in your opinion, what or how is this obesity pandemic? In fact, we should be calling obesity as a pandemic, right? How is this obesity pandemic uh, pushing or accelerating all of these arthritis or joint and bone related problems?
So let me just get down to the basics. Suppose 100 patients come to an orthopedic clinic. Majority 50 to 60% of them will come with a low back problem or a knee problem. whereas the rest will come with heel pain, shoulder pain, or some kind of a fracture. Now, what is the common condition? Now, talking in this forum, everyone must have been aware of two conditions of orthopedics called as a frozen shoulder and a plantar fasciitis, which is very common. And a tennis elbow, you keep hearing every now and then, you know each and every some person who has this problem. So, what is common in all these conditions is that there is some inflammation in the joint, causing some problem in the movement of the joint, causing a stiff elbow or low back pain. Now, the cause of this pain is inflammatory mediators. In medical term, what we call as cytokines and interleukins. So, what happens is when you sleep in the night, these inflammatory mediators they start accumulating in the joint. That's why when you wake up, we might also must have noticed that when you wake up, our joints become stiff. Like सुबह उठते ही जोड़ों में दर्द होता है, or the first step in the when you put on the floor, it's painful. It is because overnight our body is relaxed. So the inflammatory media start getting accumulated in your joints and all the tissues around. And as you progress your day, when your blood flow increases around the joints, the chemical mediators get washed off, and you feel much better. Now, if you have a high carbohydrate diet, there is a state of hyperinsulinemia. The inflammation is more and the pain is more. If you go into a low carb diet, there is hypoinsulinemia or the insulin secretion is less. There is less inflammatory mediators and half the pain causing chemicals are gone. So it's simple. You decrease carbohydrates, the pain is gone.
Wow. So, so I just have one question to ask you, and based on the answer that you just gave. You, along with many other doctors, use the word inflammation. We have been seeing the word inflammation quite a bit. So, if I have to tell the public in very simple terms, maybe one or two lines, how do you describe? So, if you tell a layperson you're inflamed, I mean, what is the kind of picture that they can put in their head to show that inflammation is actually a serious problem, and it is the starting point for many such troubles? So, if you would have to explain it in simple terms, what does inflammation actually mean?
See, in simple terms, what I tell you is like suppose you get hit by some racket or something on the wall. There are three things which happen. Redness happens, swelling happens, and pain happens, which you can see on the outside. But the same thing happens on the inside. Now, suppose there are some organs or the joint which is inside, you can't see the redness which is inside. So the similar thing, what happens on the outside of the body, the similar thing happens on the inside. The redness, suppose I get hit by a stone on the head, a small swelling comes up. So that is called something called as an inflammatory mediator. A similar kind of a thing happens on the inside. Just because we don't have X-ray eyes, we can't see it. So it's the same thing. So that's why when you have a low back pain or something, you give a hot pack or hot electric belt, what we give, what it does, it increases the blood supply, it gets washed off, it is gone. So ultimately, any kind of inflammation, you have to just wash out the chemicals and you're fine.
That's really nice, because I think inflammation for many people it's very hard to understand, while we use it pretty much in our terminology these days. So is that connected to diet by any chance? Does diet influence the amount of inflammation?
Yes, because what we call as a metabolic syndrome, which has high blood pressure, high glucose, like diabetes mellitus, and high uric acid. So we call it as a syndrome X. So a triad of these three, when there is all these three conditions in the body is in a hyperinflammation state. So this process leads to an increase in the inflammatory mediators called as cytokines. So that's why even in COVID, we saw that there is something called a cytokine storm, which causes sudden cardiac events or something. So the root cause of each and everything is a high inflammation, which is directly linked to a high carbohydrate diet.
So therefore, you're saying if your carbs are low, you will have low inflammation and you will have lesser joint pains?
Yes, because that's what we have been hearing in the talks in the last 2 days, that the cause is a hyperinsulinemia. No matter how you have one molecule of glucose or something, that much amount of insulin is secreted to digest it. Now what happens is we have gone over the threshold and we are in a hyperinsulinemic state. So in this state, the inflammation level increases. So all that, if you decrease the carbohydrate intake, eventually the insulin will get decreased and all the other conditions will get solved. Now, since I pertain to orthopedic patients and I treat them, we can see the direct change that once the inflammation goes on rest, everything gets solved. And I'm telling you, once the movement increases, the patient feels much better on the inside. He's 100% better. Like the medicine requirement, everything gets decreased. Like initially, when we had the habit of giving 2 weeks or 3 weeks tablets for some pain, with this, the tablet or that can dose we can decrease to around 1 week or even less than that.
Okay, very interesting. So at this point, I'd just like to take one question that we have.
Yes.
So a lot of people who come up with herniated discs and a few other problems. So specifically, is herniated disc treatable without surgery? Can it be treatable non-surgically or with any other alternate interventions?
Okay. So when we talk of a herniated disc, we have to look at three symptoms. First symptom is what a common term we call as a sciatica. Like the pain from the back goes down around the back of the thigh, like a needle prick sensation or a sharp shooting pain. So if the patient has a sciatica, we have to look at two more symptoms. Is he having a normal urine movement, a normal bowel movement, and whether he is able having good power in his legs. If he's having good power in his legs, if there is no problem in his bowel or bladder movement, then that kind of a disc can wait a surgical procedure and we can go to a non-surgical management with medicines, physiotherapy, a hot pack, or a few low dose steroids to reduce the inflammation. Not like it's like not 100% patients with low back pain and with discs need surgery. It's around 1 to 2%.
All
But
right.
if you just go down the road and take MRIs of 100 people down there, all of us have some mind disc, which is there, which is very common. Just because we investigated it, we come to know that they have this.
All right.
And more movement. What I say is IT professionals or those who have a sedentary habit of sitting, like sitting is the worst for the back. The more you sit, the more thing happens to the back. So we have smart watches right now. So every 35 to 40 minutes, we can just keep alarm, just stand up, just stretch sideways, and then you can go ahead. Or like just when you go wake up from the sleep, you can just do a few cat camel kind of a yoga poses, a few asanas before starting the day, and you're fine. So good movement increases the flexibility. And what happens is the early onset of disc, like there are few gradings of disc, like it is slightly prolapsed, moderately prolapsed, or severe prolapsed. Majority of this discs in grade 1 or grade 2, or what we call as stage 1 or stage 2 prolapse, once the pressure is relieved, it can go back again. So it's not like कि एक बार disc बाहर आ गया वो अंदर नहीं जाएगा. It is like a flexible thing. So if you can just relieve the stretch with a few Surya Namaskars or yoga, you can get back to normalcy.
Amazing. Superb.
And
So,
other thing what I want to tell you is like if you have obesity, like a central truncal kind of an obesity, the center of mass shifts on the anterior side. So there is more pressure on the back. So that has a direct impact on the back.
so basically, you're saying the pot belly is actually pressurizing your back and giving you a whole lot of back and hip problems.
It's like a weighing beam. So the weight is more ahead. This has to become weak. It's the same thing.
So that way, so then in terms of curing the pot belly, a dietary intervention would be the most ideal one, right?
Yes, because what I noticed is when I tell the patients to lose weight. So this was one of my motivation to lose weight was कि 2 साल बाद जब मुझे patients को बोलना होगा कि I am a doctor, I have to tell them, so I myself have to be fit first. So when I tell them कि suppose a person of 100 kilos comes to me, it is impossible for him to walk on the treadmill for 10-20 minutes. What we can do it with some dietary changes, at least for the next 1.5 to 2 months, we can at least get him 6 kilos down. Because what happens is, mechanics and biophysics wise, the load of 1 kg on the knee is equivalent to 4 kg because the forces of the body acts. So if a person loses 5 kgs, 5 into 4, it is like 20 times the load on the knee decreases every step. So that time, all the other problems of osteoarthritis, back pain, everything can it can get controlled. So the first target has to be some dietary intervention, lifestyle modification changes, slowly moving so that we can get the weight into an exercisable limit, and then he can start the other exercises.
Wow, this is pretty insightful because in most or in majority of the population who are on the obese side and who want to lose weight, you will notice that the first attempt that they do for losing weight is to go exercise. Start with the cardio, start with the treadmill, start with running, jogging, jumping. So you're saying these are not things that they should be doing first.
Yeah, because what happens is there are two things. One, we have to think about sustainability. Like whatever mode you select, you have to do minimum for a habit for 3 to 6 months. What happens is these patients already have a weaker knee, a weaker shoulder, and a weaker muscles. Now when the new year starts, the gyms are flooded with new subscriptions and everything. They go to the gym, and in the second and third week, they'll come to us with back pain or knee pain. Because your body is the same on 31st of December, it's the same on 1st of January. But our intensity of workload increases. What I can advise to the people is like if they want to join the gym, they should have a dietary plan at least 1.5 month before they join the gym, so that at least our body has some less load to start with, and it can accommodate the stress once the gym starts. And the other thing is, once the patient starts losing a few weight with dietary changes, he is first of all very happy. And the added weight loss, what he'll achieve with the gym, both of them work in harmony so that it's a sustainable lifestyle for the next 6 months.
Right. Superb. So, doctor, in your practice, when you recommend low carbohydrate and low insulin, foods and dietary practices, what kind of carbohydrates you think are more beneficial? Is there something specific that you recommend? That is one question I wanted to ask you. The other one is, how do you go about educating your patients on, how they should start making these changes and how they start making it sustainable?
Okay, so first thing I tell them is you start your habit of seeing the food labels of buying any product you buy. There are proper food labels. That is the first habit I tell them. And second habit is don't eat anything which is packed in the market. These are the first, you bombard them with a lot of restrictions, they'll be very cautious. So start slowly. I tell them that the first priority is to stop all kinds of sugar. When I tell them, we all know that there are 3 national chai time, what we say. 8 o'clock in the morning, you have to have chai. In the office, you have it 11 o'clock. And I am sure 90 to 95% of the all Indian households have chai at 4 o'clock in the evening. So if you just stop that that 1 tablespoon of sugar in a day, you follow that for the next 2-3 weeks, you have already saved 15-16 spoons of sugar in your diet. So start slow. First step, you decrease the number of table sugar. Second, you switch from a wheat or rice to a jawar or any millet. And eventually we can take it down. Because if you tell them suddenly stop everything, they don't take it. So I tell them is you first start table sugar, you stop everything. You stop your table sugar, you switch from wheat to jowar, and over the next 1 month, slowly we'll put other restrictions. Like when you go off the jowar also, you have low carbohydrate dinner, you increase your have early dinner before 7:30 or 8 o'clock, and have minimum 16 hours of fasting. So we can give them a plan of around 2 to 3 months. And what I have noticed is that immediately in the first 2 to 3 weeks, once the body changes start, half of the pains are gone. Like they feel the lethargy is gone, the freshness is like the freshness comes back, and the knee and the back pain reduces drastically. And once their movement increases because of decreased weight, it's like a vicious cycle. Your weight decreases, you feel like moving, and you're happy.
Absolutely.
So it's not like a sudden thing that you start from low carb tomorrow, you'll have effects in 1 week. It will take minimum 2 to 3 weeks for the results in your joints to come, but it is greatly sustainable.
Great. And then that's a very nice cycle. You lose weight, you automatically feel like getting up and moving, and you automatically start becoming more active, right?
Correct. Yes.
That's great. Now, okay, I have a very interesting question to ask you about some of our practices that we follow. So, since you are also a surgeon, you would be treating people, and there would be people recovering in the hospitals. And when you have people coming to visit them, you obvious choice of gifts and get well soon are a lot of fruits, a lot of biscuits, a
Right.
lot of maybe not chocolate, but at least biscuit, and then sweets made from home, laddus, and all of that. Now, what is your opinion? How good, how bad, or how neutral are you around that practice?
Um, Whatever is packed, you should not get them. I'm happy with patients getting coconut water because it has potassium, it's healthy. And all kinds of fruits are welcome. But fruit juices which are packed, that should be avoided. That's what if you want to meet a patient, if the patient is small, like if a pediatric patient or something, you can get all kinds of chocolate, it's fine for him. Like he'll be happy because we have to deal with pediatric patients in a different way than the adult patients. Because adult pediatric patients, they are not happy with being in the hospital or anything. So for them, we can allow a couple of chocolates or so, but for adults, coconut water is the best. Fruits, any kinds of fruits are fine. Apart from that, I don't like them getting anything because what they get is anything. Like I have seen patients ordering Zomato, relatives ordering Zomato. कि 2 दिन पहले surgery हुआ है, 2 दिन से कुछ खाया नहीं है, just order some Subway or something for him. I'm like, that's a big no-no.
Okay. Okay.
So fruits, we can just stick with fruits and coconut for that matter, coconut water.
And do you I mean, in sense of fruits, is there any limitation that you put in? Because there is fructose, there's sugar, and then there's a lot of other things also in fruits. We have people saying it's too much of sugar again, which will hamper recovery. So, what's your thought on that?
I think anything should not be in excess. Anything in moderation is fine. And what I personally feel is if you are like, I like to break my fast. Like I have my dinner at 8 p.m. When I break my fast at 1 p.m., it's around like 17 hours of fast. I mix it with salad. Like I have a carrot or a tomato with some fruits. So if you mix some fiber with the fruit, I think that will give much better results because then the insulin spike, which will happen with fruit, that doesn't happen because fructose, the fibers will delay the insulin spike. So first thing is nothing should be in excess; it should be in moderation. And second thing is you have anything with fiber, it does two things: it doesn't cause the insulin spike, and it helps you having good ball the next day.
All right. Excellent. And in terms of proteins,
Correct?
you think that is useful in recovery, especially when you have these accidents and you have got surgeries and you've got
Yes.
bone settings, you've got bone fractures, and all of these things, or even arthritis for that matter.
Correct.
How important is protein for all of these?
Yeah,
And
that's a very good question, ma'am, because I wanted to stress on this thing because those old patients you see, or many of our grandparents must have had a hip fracture or something. What we do is we do something called as the serum proteins, and majority of them we see an albumin to globulin ratio, and the albumin comes down to less than 2.5, 3.5. They are more prone to fracture. So we have to first give them protein supplementation IV so that post operation they can sustain the rehabilitation procedures. So there are two things. A decreased protein makes you prone for fractures because the bones have become weak, what we call as osteoporosis. Second thing is in young adults and especially postmenopausal females, because once the menopause sets in, once estrogen progesterone levels fall, the calcium dependency comes from the bones. The bones start becoming a weak immediately after menopause. So once you start protein supplementation from them, I believe that the protein supplementation, rather than having some powder or anything, it's better you have from your diet. It's very easy for me to tell some egg consuming patients you have 1 or 2 boiled eggs daily. What happens is all kinds of cartilage, they have a covering on them, which we call it as a meniscus or a cartilage. They are all made up of proteins. So it has a direct impact. You increase your protein intake, everything is fine.
so it's not just calcium anymore when it comes to bone health, right?
No,
Because you
because
have people popping calcium pills left, right, center, thinking they're helping their bones, when
Correct.
instead they're actually neglecting the bigger aspect of protein.
What happens is, I think that's a really, really good question, ma'am, because people think that calcium, when you take it, it gets directly absorbed. But they don't know is when the calcium goes into the gut, they need something called as a vitamin D to get them absorbed into the blood. So if you even have calcium tablets, half of this is just gone out from the gut. when you supplement it and add it with vitamin D, that acts in a much better role. And nowadays, after the COVID, since we were indoors for 2 years, the pollution what we have, each and every one has less vitamin D. So when we give vitamin D, we have to augment it with a calcium supplement so that they work in harmony and they then get absorbed into the body and increase the bone health.
Very interesting, Dr. Mihir. We have 5 minutes. So can you share any unique story or any interesting case from your side who has benefited from a low carbohydrate therapy that you recommend?
So when I was working in KEM hospital, last year there was a patient of 120 kgs. He had a rotator cuff injury, what we call as the muscles around it got torn. So he could not get anesthesia fitness because the chemicals which were required for a 120 kilo person could not be given to him. So he was advised a bariatric surgery, that you undergo bariatric surgery first, you get fit, and then we can get you fitness for an anesthesia procedure. He came to me, I told him that you can consider the surgery, but he was ready to commit the next 6 or 7 months. And eventually, even though he did not come down below 100, but he went to 102, he lost around 18 to 19 kgs, but ultimately he got the fitness for one surgery, which was not bariatric and a shoulder surgery. But after that, once his movement increased, he was very happy that at least he can go to the gym, do upper body exercises. And the last time I spoke to him, he was around 96 or 95, but he's slow and steady winning the race. But I'm happy that at least in him, we could avoid the bariatric surgery in him. So in place of 2 surgeries, he was happy with one. And with just talking to him and making him aware that just eat smart. Like instead of having desserts first, you have dessert small portion after the meal. He was fine. So he's like, sir, आप मुझे कुछ बंद करने मत बोलो, कैसे खाना है ये बताओ. So even just few small things can change his entire perception. So I'm just happy that I saved his one operation and now he's doing fine. I'm fine. I believe that he'll at least reach 85 or 80 kilos in the next 1 year.
That's commendable. I think it's a huge thing for for someone to move from taking a bariatric surgery to adopting lifestyle changes and then completely saying no. That's amazing. That's an amazing.
Yeah, because what I told him is that you are just 32 years. So you're not like a 50, 60 or 70-year-old guy. You still have a long way to go. And if you have the surgery at this age, it doesn't look good. So since he was young, I could motivate him much better. That's what I feel.
Wow, amazing. So, Doctor, one last question, and I'll put it as just a rapid fire. If you could summarize, the major points that you would like to share with our audience out there in terms of how to keep themselves fit and what are the lifestyle changes they should be making, can you just put that out, please?
So I believe in this triad of intermittent fasting. Minimum, you can start with 14 hours, but minimum of 16 to 8 hours fasting. Second thing is a low carbohydrate diet. You can start with the low carbohydrate to no carb dinner, and then you can switch to a low carb lunch. And third thing is increasing your water intake and movement. Water intake of more than 2 liters and steps of more than 7,500 steps. That's what my target is. So this 3 triad works wonders in all aspects.
Amazing, amazing. Thank you so much, Dr. Mihir, for your inputs. We have Sashi as well. So, yes. Sashi, your last few words for Dr. Mihir for the question.
I want to.
I'm sorry to cut you, sir. I just want to add one thing. Sure. In my Apple Watch, I have put notifications of Arun Kumar sir's tweets. So in the morning when I wake up, I get warnings. Yeah. So you have to take care of your health. So I can advise to all those who are listening, you can do that. You can put notifications in your phone of Arun Kumar sir's tweets so that daily you have motivation 24/7.
Arun Kumar is my guru and he makes very, very simple tweets. Yeah. Someone was suggesting you do this. I told Arun Kumar, don't do. You continue doing these small tweets, which is very, very interesting. Yeah. And coming back to this, Dr. Mihir, I wanted to thank you personally for coming in this session and sharing your knowledge on low carb and intermittent fasting. It is so fascinating to see an orthopedic surgeon talking on this. And one doctor convinced on this, you are going to heal many patients, thousands of patients in your lifetime, or lakhs of patients, I may say. it's a cascading effect, and we are so happy to have you in this session. Thank you.
Thank you so much, sir. Thank you so much, Anjali ma'am.
Thank you so much, Mihir.